Imagine buying like a $2 billion lottery ticket.
Which is already a wild financial proposition.
Right, totally nuts. But you have a 90% chance of losing. And to make matters worse, it's going to take about 15 years to even find out if you won.
Yeah, that's historically been the grueling standard operating procedure for global drug discovery.
A completely exhausting marathon.
Oh.
But, well, welcome to today's deep dive, because we've tailored this one specifically for you, the listener, because that 15-year guessing game, it's over.
It really is. We are living in the new reality of 2026.
Exactly. And today we're unpacking the architecture behind Pharmaceutical Superintelligence, or PSI. We're looking at a fully autonomous prompt-to-drug pipeline where, a researcher can type a plain language prompt describing a disease, and this massive ecosystem of specialized AI agents just takes over.
And they design a clinically de-risked drug in months, not years, months.
Right, and we really need to emphasize for you guys listening that this is not just some faster calculator.
No, not at all. It's a fundamental shift from, trial and error biology to deterministic engineering. We are essentially mapping out a digital factory today.
That's the perfect way to frame it, honestly. A digital factory powered by two main pillars: molecular and biological reasoning and accelerated kinetic simulation.
Yeah, but to even get this factory running, we hit an immediate wall.
Right, because before an AI can design a drug, it has to actually read the biological target. And AI models are great at reading text, like linear sentences. But biology is this chaotic, noisy, continuous 3D spaghetti of proteins.
Well, spaghetti is a very good word for it.
So how does a language model process a three-dimensional knot?
Well, that is the foundational hurdle.
Okay.
You can't just feed raw, noisy geometric coordinates into an LLM and expect it to understand function.
Because it's just a shape.
Right. So this is where a tool called Protein V1 sets the stage. It's a fully open source biomolecular structure prediction model, and it operates at AlphaFold 3-level performance.
Wow.
Yeah, across diverse molecular modalities. So it gives the autonomous agents that high-fidelity structural foundation they need to even start reasoning.
Okay, so Proteinics gives us the raw 3D picture.
Yeah.
But that's still just a shape, right? It's not a language.
Exactly. Which brings in GEOBPE, or geometric byte-pair encoding.
The ultimate translator.
Pretty much. Think of GEOBPE as the protein structure tokenizer. It takes that continuous 3D protein backbone and transforms it into discrete symbolic sentences.
So the AI agents can actually read it like text.
Yes. It establishes a geometry-grounded linguistic foundation.
Okay, but I'm trying to visualize how you chop up a 3D structure without losing the actual physical reality of the shape. I mean, if you break it into discrete pieces, doesn't the protein kind of
fall apart?
Yeah, like a bad panoramic photo where the edges don't line up at all.
Oh, you're describing geometric drift, which has historically plagued a lot of these models. But GEOBPE solves this by optimizing the glue angles at the boundaries. It reduces the sheer structural complexity, but...
Okay, that makes sense. So GEOPE is basically taking this chaotic, floating 3D jigsaw puzzle and pinning the pieces down into an alphabet.
That's a great analogy.
But that only solves half the problem, right? We have an alphabet for static shapes. But proteins inside a human body are constantly moving. They vibrate, they interact.
They're highly dynamic, yes.
So a static picture doesn't tell me how a protein behaves when a drug approaches it.
And that is a critical blind spot. So to address the movement, the pipeline uses stripes.
Stripes. Okay, what does that do?
Stripes is employed to capture the temporal dynamics. It looks at how proteins and ligands, the drug molecules, recognize each other over time.
So if GEOPE is mapping the static shape, stripes is, well, it's like motion capture technology in a movie.
Oh, exactly. It's not just mapping the actor's face.
Right, it's mapping how the muscles stretch and pull in real time when they interact with something else.
Yes, and by deriving symbolic sequences from those interaction dynamics, stripes represents protein-ligand recognition as actual sentences.
Sentences based on movement.
Right. It captures recognition-relevant temporal information that is totally inaccessible if you're only looking at a frozen structure. So the AI can do de novo design of bioactive molecules conditioned on these specific interaction sentences.
That is just mind-blowing. Okay, so the AI can read the protein, and it understands the motion capture dynamics. Now we have to figure out where to actually attach the drug to stop the disease.
Finding the target.
Right. And historically, scientists would look for a very obvious active site, like the main keyhole on the door. And if the keyhole was too shallow, they just throw their hands up and call it undruggable.
Yeah, the concept of an undruggable target is essentially being erased by this new pipeline.
Because we don't have to wait for humans to squint at a 3D structure anymore.
Exactly. The system deploys all else sites.
Yeah.
This enables sequence-based identification of binding sites across all drug modalities.
Meaning small molecules, peptides, DNA, RNA.
All of them.
Yeah.
It massively expands the targetable proteome without even requiring resolved experimental structures.
Okay, that opens up the map considerably. But what if the main active site is genuinely inaccessible? You can map it all day, but if a drug can't fit, it can't fit.
Well, then you don't attack the main site. You use DeepAllo.
DeepAllo.
Right. It leverages protein language models and multitask learning to hunt down allosteric binding sites.
Allosteric sites. These are the hidden backdoors, right? Sites that are physically distant from the main active site?
Yes. The beauty of an allosteric site is that when a drug binds to it, it causes a conformational change that ripples across the protein.
Oh, so it alters the shape of the main active site from a distance.
Precisely. DeepAllo finds these hidden levers, significantly expanding the druggable space.
That's wild. But what if the protein itself is just a lost cause? Say the disease is mutated at beyond repair. Can this system go further upstream?
It does. The autonomous agents use alpha genome to decode the dark matter of the genome.
The dark.
Yeah, the non-coding DNA. Alpha genome predicts the regulatory effects of non-coding DNA variants. This allows the system to identify entirely novel regulatory targets before a problematic protein is even fully transcribed.
All right, let me play devil's advocate here for a second. We have all sites expanding the map.
Oh.
DeepAllo finding hidden backdoors. Alpha genome unlocking the dark matter of DNA. And then the source material mentions drug CLIP,
Yes, drug CLIP.
which utilizes deep contrastive learning to align these newly found pockets with potential drug molecules millions of times faster than traditional docking.
Millions of times faster, the acceleration is staggering.
But doesn't that acceleration create a massive bottleneck? I mean, if the AI is finding millions of hidden doors and matching them with millions of potential drugs, how does the human researcher know which option is actually worth pursuing?
We've just turned a scarcity problem into an overwhelming haystack problem.
Exactly.
Well, it would be a haystack problem if the AI just dumped the raw data on a researcher's desk. But the ecosystem prioritizes the targets autonomously through TID Pro.
TID Pro, so it's a filter.
It's an advanced prioritization engine. It integrates 22 distinct feature scores across omics, literature, and clinical data.
Oh, wow.
Yeah, so it evaluates every single one of those candidates to identify the ones with the highest intrinsic probability of clinical success.
Okay, so it's not just generating options, it's aggressively curating them. But that brings up a really crucial vulnerability, I think.
Which is?
An AI can draw a mathematically beautiful molecule that fits perfectly into a simulated pocket on a screen. But if that molecule immediately falls apart the second it touches a living, breathing human cell, the whole multi-billion-dollar system is useless.
Right. The simulation has to match biological reality.
So how does PSI ensure its ideas are physically real?
Well, we ground the AI using BioReason Pro. This serves as the integrative reasoning core of the system.
What does that mean in practice?
It analyzes the domain architecture and the evolutionary context of the target. It generates structured reasoning traces, which allows the system to de novo predict binding partners and precise contact residues using actual biological logic.
Biological logic is great, but a whole cell is incredibly messy. If I introduce a new chemical to stop a disease, how do I know it won't accidentally shut down a completely unrelated vital process somewhere else in the cell?
You test it virtually using Excel. Think of Excel as a diffusion language model that functions as an in silico CRISPR screen.
In silico, so totally virtual.
Exactly. It predicts causal gene expression responses to genetic and chemical perturbations across diverse cellular contexts.
It systematically simulates the collateral damage.
Yes.
Yeah.
It identifies and validates novel therapeutic targets before you ever touch a physical petri dish. And we have to push that reality check even further down to the basic laws of chemistry.
Right, because a drug will behave very differently in the highly acidic environment of the stomach compared to, say, the neutral pH of the bloodstream.
Which is handled by Unipica. This tool models the full space of possible protonation microstates.
Protonation microstates. Okay, that sounds intense.
It just ensures thermodynamic consistency in the molecular representations. which is absolutely vital for simulating how a small molecule will actually behave in physiological environments.
Okay, I have to bring up a phenomenon we've all seen with early AI models. Like when an image generator spits out a picture of a human hand with 7 fingers.
Right, the classic AI hallucination.
Exactly. The model learned the statistical pattern of fingers, but it completely failed to understand the underlying physical reality of what a hand is. So how do we know these pharmaceutical AI models aren't just hallucinating 7-fingered molecules?
How do we know they actually understand chemistry?
Yes.
That is where WSP comes in. WSP is a Python-based workflow for interpretability scoring.
Yep.
It utilizes matched molecular pairs, or MMPs. Basically, it takes two molecules that are nearly identical except for one tiny chemical change.
And it tests the AI on them.
Exactly. It quantifies whether the machine learning models genuinely capture the underlying chemical relationships or if they're just guessing.
So CAR-T is essentially checking the AI's math.
Yes, ensuring that lead optimization decisions are based on meaningful chemistry rather than just numerical noise.
That makes a ton of sense.
Yeah.
But to get an AI to this level of sanity, where it understands biology, chemistry, and thermodynamics, you have to train it. You can't just take an off-the-shelf chatbot and ask it to cure diseases.
Absolutely not. The core models driving all these tools need a highly specific education, and that transition from a general-purpose model to a pharmaceutical-grade engine happens in the Science MMAI gym.
Science MMAI Gym.
Right. It provides the training curriculum using high-quality reasoning datasets and multitask supervised fine-tuning.
And I noticed in the source material it also mentions polymath learning.
Yes, polymath learning is a specifically designed multidisciplinary math training sample. It enhances the reasoning capabilities of the models across physics, chemistry, and biology.
Which makes sense. You have to teach the model the fundamental mathematical logic of the universe before you unleash it on human biology.
And once it's trained, human biologists actually need to be able to talk to it.
Right.
That interface is PandaClaw. It powers biological hypothesis building through an intuitive natural language interface. So biologists can interact seamlessly with these incredibly complex agentic workflows.
But introducing a human interface and having all these specialized AI agents passing data back and forth, doesn't that create a massive cybersecurity nightmare?
It absolutely could.
Especially if these tools are collaborating across different research organizations. You have highly proprietary drug data and sensitive patient health information flying around.
Security is paramount, which is why the enhanced A2A or agent-to-agent protocol is employed.
What does that do?
It improves secure communication by implementing short-lived tokens and explicit consent flows. So it protects sensitive credentials while promoting agent interoperability across organizational boundaries.
Okay, so the data is locked down, the AI agents are trained, they've found the hidden targets, and they've vetted the chemistry. We have arrived at the ultimate test.
The simulation phase.
Right, simulating the exact moment the new drug binds to the disease target. And this brings us face-to-face with the biggest historical bottleneck in computational biology, the timescale problem.
The timescale problem is the wall that traditional computation could never scale. Because biological processes like a protein folding or a drug binding happen in milliseconds.
Which sounds fast to us.
It does, but traditional classical molecular dynamics simulations can only calculate movement in femtoseconds, quadrillionths of a second.
Right. Trying to simulate drug binding with traditional methods is, well, it's like trying to simulate a marathon by calculating every single microscopic vibration of the runner's shoelaces.
That is a very accurate way to put it. It would take forever.
So how do we speed it up?
The PSI stack uses Deep Jump. Deep Jump addresses the timescale problem by providing approximately a 1,000 times acceleration of molecular dynamics simulations.
1,000 times faster.
Yeah. It uses flow matching to predict protein conformational kinetics. It allows the system to literally jump across temporal scales.
Okay, skipping the shoelace vibrations and just looking directly at the stride. But if you're jumping time, don't you worry about skipping over crucial, rare events, like a protein suddenly changing shape.
That is exactly what you employ BioEMO for. BioEMO seeds downstream simulations to sample Boltzmann-weighted conformational populations.
Boltzmann-weighted, so it focuses computational power only on the structural states that actually matter in nature.
Exactly. It resolves functionally important transitions, like kinase active to inactive switches. BioEMO generates the initial structures to capture rare shifts that a slow simulation would just never reach.
And the source also mentioned XNDiff here, right?
Yes. XNDiff integrates experimental data with diffusion models to generate protein conformational ensembles from sequences. So even as we jump through time, our discovery process is guided by actual biological motion.
We're anchored by experimental truth. But I have to push back on this acceleration a bit. If we are skipping time and accelerating simulations by 1,000 times, don't we inherently lose the high-definition precision we need?
That's the classical trade-off, yes. Speed versus accuracy.
Right, so how does the pipeline maintain accuracy without, melting every supercomputer on Earth?
By using AMP BMSMM, this is the physically rigorous foundation for PSI simulations. It achieves density functional theory, or DFT, accuracy.
And DFT accuracy is effectively quantum-level precision, right?
Yeah.
Simulating the actual electron behavior.
Yes. But the real breakthrough is that AMP BMSMM achieves this with sublinear scaling, which means it can do this high-precision modeling on a single GPU.
Wait, on a single GPU?
Yes.
Because historically, quantum calculations were so expensive, you had to draw a tiny microscopic box around just the active site. You'd calculate the inside of the box perfectly, but everything outside was just an approximation.
Which created massive cutoff artifacts. Because the physics inside the box didn't match the physics outside, AMP BMSMM eliminates this. It enables high-precision modeling for the entire system without those boundaries.
And we apply that same precision to the drug molecule itself.
We do, through MESOF. It provides short-range transferable machine learning force fields for organic molecules, also with DFT accuracy. So the molecular dynamic simulations get first principles predictive modeling of exactly how the drug fragment behaves.
Wow. Pulling all of this together.
Yeah.
It's staggering. I mean, this prompt-to-drug pipeline is a meticulously orchestrated symphony.
It really is.
We've seen how GEOBPE and stripes translate biology, how all sites in DeepHallow find hidden targets, how Science MMAI Gym educates the agents, and how Deep Jump and AMP BMSMM simulate the physics in Fast Forward.
It's replacing decade-long guesswork with testable deterministic engineering.
It is an incredible leap forward. But, as we wrap up today's deep dive, there's a lingering, somewhat provocative thought from our sources that I want to leave you, the listener, to mull over.
It's an important caveat.
Yeah. We are rapidly moving toward a world where these PSI tools are perfectly optimized. They're capable of generating virtual twins of patients for clinical trials. Very efficient, controlled biological engineering.
But maybe too controlled.
Exactly. If an autonomous system is constantly pruning away unconventional or low-probability paths to find the single most efficient drug, do we risk a fundamental loss of exploration power?
It's a real question.
Might the AI design out the very serendipity and weirdness that has historically driven our greatest scientific breakthroughs? I mean, penicillin was an accident. It was an anomaly on a petri dish. If the AI doesn't have room for anomalies, what blind spots are we engineering into our own future?
Something to really think about.
Absolutely. Thank you so much for joining us for this deep dive into the architecture of pharmaceutical superintelligence.